Hi there, I'm David Brennan. I'm the CEO of Huon Regional Care. We're a very proud part of the Huon Valley, supporting older people at home, through our aged care services and through our rural health beds. A part of Dover that we're very proud of is the partnership that we have with Huon Valley Council and with the Tasmanian Health Service to provide 3 subacute or rural health beds in Dover. This is a very important service for the southern Huon Valley, where we provide step up or step down services. By that I mean that if you're ill but not quite ill enough to end up in the Royal, you've got access to beds right here in Dover. On the other hand, if you happen to have been unlucky enough to make it into the Royal and you need to recover closer to home, you can also step down out of the Royal into the 3 beds that we have.
My name is Mal Harner. Patients call me Dr. Mal. I'm one of the GPs here. So I started last year as a part-time registrar. Now I'm a fellow GP, one of the practice GPs. I also help service the rural health beds with some of the other doctors. I think patients who live in a rural area often are in a rural area for a reason, whether that's where they grew up or they've chose to move here away from the city. So I think that there is a lot of reluctance in the community to have to go into the city if they do need an admission. So there's often a very big sense of relief that they can come back. Even if they're not quite ready for home, or a relief that they may not have to go all the way into the Royal. You have a lot of elderly patients who might actually struggle more in a big hospital with, more patients around, high risk for getting sick or getting a delirium or getting confused. So being somewhere that's a bit more familiar to them, especially being looked after by doctors who know them, and also being closer to family can be really beneficial.
I've recently had a little stay up here in the hospital in one of the rural health beds, which was more for monitoring and observation as a subacute patient. I cannot speak too highly of my experience here. The staff are absolutely amazing. The food is fantastic because it's locally cooked in their kitchen and fresh, and that makes a huge difference to the quality. The staff just could not do enough for you, from the RNs down to the cleaners. It was comfortable. Even the bed was better than ones you get in a normal hospital, which was amazing. Fresh, clean, updated, I couldn't, as I said, can't speak too highly of my experience here.
Across a year, it's up to about 1,100 nights of support are provided, and we couldn't do that without Huon Valley Council and the medical centre and that partnership that we work with every day to support the people that are in those beds. And together with Council, also planning into the future about what health services could look like and what our shared role in that is.